So when I see a couple with miscarriages, the most important thing to do to start with will be to take a detailed history of the type of miscarriage, the timing of the miscarriage, the number of miscarriages, any other circumstances around those pregnancies. Examination, and that would entail maybe an ultrasound scan of the shape of the womb, and a full assessment of the couple to see if there's any clinical indications of why the miscarriages have occurred. The third part would be to do the appropriate investigations to try to identify the causes of the recurrent miscarriages. And that will entail immune tests, mainly looking at things such as the immune system, for example, looking at the natural killer cells, and these cells that sometimes wrongly identifies the pregnancy as foreign and attack it and cause a miscarriage. We've also developed more detailed tests where we can actually look at these cells in a pregnancy environment. So we create a pregnancy environment on the sample that you give us and identify if there is a problem with these cells and what appropriate medications we can use to make them normal again. We will also do some other tests such as hormonal imbalances, thyroid function, prolactin, a thrombophilia screen, which is a sticky blood, and that's quite a lot of bottles we take from you to identify if there is any problem in that area that lead to a miscarriage. As mentioned, a scan is always important to assess if there's any problem with the womb or any other aspects of your pelvis that will lead us to think that it's a cause of miscarriage. With regard to men, so the partner, sometimes we need to do some investigations, in particular looking at the sperms and specialized tests on the sperms such as DNA fragmentation, which when we look into the genetic makeup of the sperms to see if it can contribute to a miscarriage. The full assessment is done for the couple, and the tests are individualized for each couple according to the type of miscarriages they have. Last but not least, infections. So in particular in the second trimester losses, we would want to see if there is any evidence of recurrent infections in the pelvis that may lead to a pregnancy loss in the second trimester.